like after the 10th or 12 weeks of GcMAF, they get to calm down. It was in the beginning of giving the GcMAF that they get hyper.
My last question.
Yes.
It is said that we can administer the GcMAF as we administer insulin. Can we do that at home, or should we take it to a person who is qualified to do it?
If one of the parents is a nurse or paramedical or a pharmacist or a doctor, they can do it at home. Most of my parents, they have either a relative or they can go to a closest medical center and they can, it's easy to get there. Most of them, they give it at home.
Thank you.
Doctor, thanks for the presentation.
Thank you.
One last question.
Okay. If I might, I'm Dr. Bradstreet. Some of you may know me. I'll be speaking after lunch, but and not to disagree, and I don't know the rules in Jordan, but in the United States, it's very easy to administer it subcutaneously. The paper that was published was subcutaneous injection. And I'll be talking about oral administration of the Go Lake version of GcMAF in my talk as well. So I'll see you at lunch, after lunch, and we'll talk about some of those options.
I just have one more question.
Yeah. Yes, I'm not a doctor, I'm just a parent of an autistic child. At the moment I'm giving to my son, I'm giving him method B12 at the moment. And then with the vitamin D and folinic acid. Now, if I want to use your, the GcMAF, do I have to discontinue what I'm doing right now, or can I take on board GcMAF with method B12 and other things that I'm doing to outside the moment?
Very good question. Yes, you can continue the course of what you are doing right now until you finish the course. There is no contraindication between GcMAF and other vitamins or supplements that you are currently using. So you can just add GcMAF. And if you are using B12, for example, or folic acid for the last 2-3 months or 6 months, and you have seen the results, you have the baseline. Once you add the GcMAF, you will tell the difference. You will know that GcMAF made the difference. If you want to make sure that it's the GcMAF that's doing the difference in the child, you can stop B12 folic acid and just do GcMAF and vitamin D with B and water. Thank you.
One last question, please. Excuse me, Doctor.
Yes.
Thanks for the presentation. My son is ADHD problem. He is already hyperactive. But as you mentioned, with this GcMAF, there is a probability of increasing in hyperactiveness.
Yes.
You mentioned that it will be there for only a few weeks only.
Yes.
Then it will come down means it is common for all the patients, or it is relevant to the specific patients?
Hyperactivity is one of the symptoms that we see in most of the autism spectrum disorder kids. Most of them, they are hyper, and they have poor attention, and they don't listen, and they have some other behavioral issues. So this is part of the problem they have. However, adding GcMAF does not mean that we are creating a new complication or a new symptoms in them. It just makes things in this symptom only, in the hyperactivity, makes things a little bit worse for the family. Like they complain, they say, we cannot control the kid anymore. The kid is up and running all the day or all the time, or up late, he cannot sleep early. So in this case, we reassure them first that this is because of the GcMAF, and it's a very temporary, benign side effect. The other thing we can give also, calming vitamins and some other therapies to calm the kid down. Like we have solution for this. We have the many vitamins to calm the kid and to reduce hyperactivity. One of them is the GABA gamma-amino butyric acid, which is very common, and we use it quite often. The other thing is 5-hydroxytryptophan, 5-HTP. And the main thing, even before all of that, is sugar-free diet. If you avoid sugar, you treat hyperactivity by almost more than 50%. Just avoiding sugar and concentrated sweets.
Right, can I please stop questions now? You have all afternoon to ask questions. And we have many speakers on autism this afternoon, starting with Dr. Jeffrey Bradstreet just after lunch. So thank you very much, Dr. Mohammad. I'd just like to say that we've now treated 3,000 autistic children, and the results started out as 85% improve, and we completely cure autism in 15% of children. But some doctors, like Dr. Zoya Wojtenko and Dr. Jeffrey Bradstreet, have now got better results from that, and you'll be hearing those this afternoon. Thank you very much. We'll now break for lunch and come back at 2:15.
Okay.